are you doing something that's causing you harm? And with that knowledge of the harm that it's doing you, are you still doing this behavior or this substance? It could be anything. It could be online gaming, it could be use of social media, shopping.
How do you see the link between trauma and addiction?
So actual brain cells die when the levels of cortisol, the stress hormone, are too high. There is an underlying trauma very often that's driving this drinking behavior. I'll often describe addiction a bit like a parasite, and it will lie to you, it will mislead you, it will distort reality. Essentially, once you start, you can't stop.
Are you drinking yourself? Hello, everyone, to today's episode. We are again in London. Today, we are with David McLaughlin in London in the Priory Clinic in Roehampton. Thank you, David, for having us here in your office. I am excited to talk to David about addiction and trauma. We are here to help you heal on your journey. Thank you, David, for speaking with me about trauma. David, before we dive into everything, David, you are the leading or one of UK's leading experts in addiction, and you have also your own app that helps people with addiction. That sounds very interesting, and I'm curious, how did you get into psychiatry and into your profession?
Yeah, first of all, thank you so much for having me on your show. It's a real privilege and honor, actually. Um, how did I get into psychiatry and addiction? So when I was at school, I was a bit of a nerd, and I really loved sciences, biology especially. Um, and one of my sisters was a doctor. She was studying at medical school, and I saw her medical textbooks, and I was just really fascinated. So I applied for medical school, and I got in. And when I was a medical student, I had the opportunity to take a year out of medicine to do a degree in neuroscience. So I did a BMSc in neuroscience. And when we were studying the brain, the thing that I thought was most fascinating about the brain wasn't necessarily things like the movement of your muscles or anything. It was your thoughts and your feelings. And we also studied a module in addiction as well during that bachelor's in neuroscience. So then when I finished my medical degree and I came down to London to work as a junior doctor, I sought out every opportunity I could to get more experience in psychiatry. And I was really lucky. I won a place at the Institute of Psychiatry, Psychology, and Neuroscience. And so I did
Wow.
my 5 years postgraduate training to become a psychiatrist. And I just really loved it. It was fascinating being able to combine that background in medicine, being a doctor, but also applying that to people's lives. And it was an area where I felt that it was really underserved and it was really stigmatized. And at that time, this was like 20 years ago, people with mental health difficulties, trauma, anxiety, depression,
Mm.
addiction, bipolar, schizophrenia, all of these different conditions, they were stigmatized, and it was difficult for them to get access to the support that they needed and wanted. And so for me, that felt like a calling, and I've always wanted to support those in most need. And it was just like a real privilege to get to help people and to understand their lives and to use that background, the training that I've been given to help people.
When we speak about addiction, what would you say for someone who is not really, sure if they deal with an addiction? What would you say is an addiction, and how can that look like?
Yeah. So there's different qualities and traits that would maybe define addiction according to the diagnostic manuals. But one of the things that I always come back to with my patients is, are you doing something that's causing you harm? And with that knowledge of the harm that it's doing you, are you still doing this behavior or this substance? And that harm could be physical harm, it could be psychological, emotional harm, it could be financial harm, or it could be harming your relationships with people around you, or it could be harming your education or your occupation, your career. But if you recognize that this substance or this behavior is still causing you harm and you're still doing it, then for me, that's a sign that this is a substance or behavior that's outside of your control and it's addictive.
Wow. So if when I look, and everyone knows I work with people with trauma, and I see a lot of people having obviously coping mechanisms, and a lot of times they're linked to alcohol, drugs, can be also other things,
Mm.
more, let's say, porn addiction, gambling addictions, other ways of coping, gaming.
Mhm.
Um, how do you see the link between trauma and addiction?
So I guess, as you said, I also have lots of patients who come to see me at the Priory Hospital here, and a lot of them will have a history of trauma, and others will have a history of anxiety or low mood or sometimes insomnia. But there's often some sort of underlying psychological distress. And very often people will turn to substances or behaviors to self medicate.
Mm-hmm.
And often those self medicating substances could be things like alcohol or cocaine or nicotine, ketamine, and behaviors like you mentioned, sex, porn, gambling. But very often it's a coping mechanism. It's a harmful, maladaptive coping mechanism, and it's a way of self-medicating for this underlying psychological distress. And so again, one of the things I do in clinic is really try to understand why somebody is continuing to do something which is causing them harm. And there's usually a very good reason, because there's some way that it's serving them. There's some mechanism by which it's actually providing them with something. And that's something that I like to acknowledge with people when they come to see me. Whether it's with alcohol, I'll say to them in a open, non-judgmental way, what is it that alcohol serves you? How does it benefit you? Why is it? And often they'll say things like, it numbs the pain, or it makes me forget about the past.
Yeah.
It just blocks everything out, or I can't sleep unless I have a bottle of wine. And so I use this substance to help me in some way. It helps with my social anxiety before if I'm in at a party and I just feel really self-conscious. Having a glass of wine in my hand is the tool that I use to self-medicate, to manage that horrible feeling of being anxious and self-conscious. So one of the things I always do in a totally open, non-judgmental way, just exploring with somebody, how is this serving them? This, whether that's alcohol, cocaine, nicotine, ketamine, porn, gambling,
Mm-hmm.
what is it that this substance does that meets what is the underlying need?
When I struggled with I was diagnosed with PTSD. This was many moons ago.
Hmm.
I noticed one thing, and that was a major shift. I was never really into alcohol, never really
Hmm.
tolerated, but at that time, I didn't have the tools, the resources, and I used a glass of wine here, a glass of them. It became more and more. It was maybe a short phase until I then continued on my whole healing journey. But I noticed I was so overwhelmed,
Yeah.
overwhelmed with also how my body responded when I had PTSD. And when do we call it addiction, or when do we see, like, is it normal that we sometimes cope with,
Hmm.
let's say, overwhelming feelings, and then we have the ability to be self-aware and change it? Or is it when and how much is, let's say, too much? When is do we call it addiction?
Yeah, I think that experience that you described there is so common. It's something that I've seen a lot of the time with my patients. On the Curb app, that we talked about that earlier as well. The people in the community, the online community in the forum, they will share their own personal experiences and their trauma. And I think that's so rich for people, especially your audience, to hear that they're not alone, that there's so many people have trauma. This is a very common thing. They may not have talked about it with anybody else, but I think it gives them strength to know that other people have experienced those traumatic events as well. And I think it's very common, particularly to use alcohol to numb those feelings, to the physical sensations in our body, the emotional experience that we have. I mean, you asked, when is it an addiction? And again, one of the things that I would ask somebody if they were sitting next to me in clinic, I would say, has your use of alcohol increased? Are you drinking more often than you were before? Have you developed tolerance? So actually you're needing to drink more of the alcohol to get the same effect. Are you finding that, you don't get drunk after one glass or two glasses of wine? You're actually able to drink a bottle of wine or even two bottles of wine without feeling that you're intoxicated. That's a sign that your GABA receptors have become desensitized, because they're so used to the presence of alcohol that those GABA receptors that alcohol binds to, they've become desensitized and numbed. So you develop tolerance. also, is there loss of control? So are you noticing that once you've started drinking, that you're not able to stop? And we see that loss of control with other substances, like even with, chocolate popcorn. There's a famous brand of crisps in the UK that they have a motto, which is like, essentially, once you start, you can't stop. And so that loss of control is another defining characteristic.
Okay.
Another defining characteristic we mentioned was that continued use despite knowledge of it's doing you harms, which we've already talked about. But there's various kind of these telltale signs that this is changing from social use of the substance, like alcohol, and it's actually, we're kind of going into the addiction dependency. The other really important thing, last characteristic of addiction, which is really important to talk about actually, is with the presence of withdrawal symptoms. So so often people, when they drink very heavily, if they drink every single day over a long period of time, their body can get physiologically dependent on it. And then when they stop drinking, they experience withdrawal symptoms. So that with alcohol, it could be tremors, shakes, sweating, increase in anxiety, and in extreme cases, you can even get seizures and hallucinations. We call that delirium tremens. So it's really important that if there is anybody that drinks very, very heavily, not to suddenly stop. Always speak to your doctor and get advice about how best to quit drinking.
Wow. I didn't know about the seizure part. That is scary, huh? Wow.
It has a mortality rate of 10%. Delirium tremens is, when I was at medical school, we were always taught delirium tremens is a medical emergency. So if somebody is, if somebody suddenly stops drinking and they're shaking kind of heavily, very sweaty, and even hallucinating, having a seizure, this is a medical emergency, and they either need to drink alcohol essentially or get treatment with benzodiazepines. But it has a mortality rate of 10%.
Okay. Wow. Benzo, they are also addictive in a way. Again, right?
They are another, especially in the UK. I don't know elsewhere in the world, but it's a very common addiction, because it's very similar to alcohol. People use it to self-medicate, and again, it's really effective in the short term for managing anxiety, helping people to sleep. But it's almost too effective because people can very quickly become dependent on it, and their receptors adapt. And then when the receptors are used to the presence of this medication, and you suddenly take it away, the receptors have a rebound excitation, and so they become hyperactive, and you get this rebound anxiety, but also such excitability and electrical activity in the brain that it can provoke a seizure.
God. But when we talk about addiction, and there's obviously, now we talked about alcohol addiction and there's drug addiction, but are there things that people are not very aware of that they could be struggling with, or not even aware that they have that addiction? That I'm talking about social media or other things in our life that we quote unquote normalized, or they're normalized in society.
There's lots of things that people can get addicted to, whether that's substances or behaviors. The academics have a very strict criteria of what addiction is, but arguably anything that is rewarding in some way, that provides a dopaminergic spike. So dopamine is a neurotransmitter in your brain, and it's a neurotransmitter that when something good happens, that the levels go up. Interestingly, the levels of dopamine also go up when you anticipate the good thing happening. So when you're thinking about the good thing happening, or you're imagining the good thing happening, when you're waiting for it to happen, the dopamine levels will go up. And that's the rewarding, reinforcing neurotransmitter. So when you think about having chocolate, when you're, maybe if you're gambling, it's the anticipation, the expectation, waiting for the good thing to happen, that also releases that spike of dopamine. So any of these things can be considered addictive.
So if I identify myself, let's say I'm going in my day and I'm like, oh, I game every day. Is that then what I would call an addiction? Or I eat chocolate every day and I cannot let go of it because I also then think about it, or maybe, let's say, quote unquote, obsess about it. Is that where I would already need to not necessarily ask for help, but be self-aware and be like, wait, something, I need to help myself here, or I need to change something? Is that so sort of indicator?
Yeah. So, like, I mean, it could be anything. It could be online gaming. It could be use of social media, shopping, online shopping. It's a very common addiction, especially in different parts of the
Hmm.
world as well. You see different patterns of behavior that are like, for example, in Japan, online gaming is much more common. In Southeast Asia, shopping is a very common addiction. What what I would ask people to check in themselves, I'd say, is this behavior within your control? Have you tried to reduce or cut down this behavior and really struggled, find it difficult? Have you noticed that it's causing you harm in any way, financially, emotionally, physically, to your family, friends, work, but yet you're still carrying on this behavior? Is the behavior escalating? Are you
Hmm.
doing it more often? Is it something that if you don't do this behavior or get access to this substance, do you get negative like withdrawal symptoms? Do you feel anxious or irritable?
Hmm.
Have you reduced any of your other behaviors, things that you would normally enjoy doing, like other activities, like seeing family or friends or work? Have you actually reduced those activities in favor of this behavior, which is potentially addictive? Um, and we call that primacy or salience, where you've really prioritized this one thing. This one thing is much more important to you than other aspects of your life, and the rest of your life has become less rich because you've prioritized this one behavior.
And if, for example, because see a lot of times the link, I always call it in my reels on my social media, when people cope, well, let's say, with
Yeah.
gaming or shopping or, also alcohol, that I always say it's a trauma response.
Mhm.
Is that actually correct what I'm saying? Or do you say, like, no, wait a minute, there's something else going on? Because I always think, like, okay, from research and from what I understood, trauma changes your brain.
Yes,
And
definitely.
why do we cope with, let's say, the whole list of things sometimes, or a few things of this? Why do we do that?
So it's so interesting. I mean, you talked about trauma changing your brain, and we know from various studies in vitro studies, so basically petri dishes, we've looked at the way that cells respond to the stress hormone cortisol. So when we're stressed, we
Mhm.
release cortisol, but cortisol is neurotoxic. So what that means is that it kills cells. So actual brain cells die when they're exposed to too high, when the levels of cortisol, the stress hormone, are too high. But we've also seen in we call it in viva studies. So when we've looked at real people in the real world, when they have a history of trauma, whether that's childhood trauma or an adulthood, and we put them through a scanner,
Mhm.
and we look at the structure and their function of their brains are structurally different, and they behave differently. So there's different parts like the hippocampus, the hypothalamus, sorry,
Mhm.
that they shrink, they become smaller, and it's because of that neurotoxicity of that hormone cortisol. And but also other parts of the brain, like the amygdala, that's the emotional epicenter. Those parts of the brains can become hyperactive. So the cells
Mhm.
and the neurons there are much more much more active than they should be. So we become hyper vigilant. Our emotional responses become much bigger than they otherwise would have been. And again, all of those things are a trauma response. And so, of course, when your brain is behaving differently, it's natural to want to try and correct that and to self medicate. And so, people often turn to substances like alcohol. Now, there's a professor called Professor David Nutt who did a really interesting study, and it looked at why people drink. And he broke it down into four main reasons. You get people who drink to enhance a positive experience because they're having fun and they want to become more disinhibited, let their hair
Mhm.
down,
Mhm.
and they drink to enhance the experience. You get people who drink for social conformity because everybody else is doing it and they just want to blend in. They don't want to stand out. You get people who drink for social cohesion because they enjoy the shared experience of drinking and having the same experience as others around them. So it's not about blending in, but it's about to have a shared experience. But a lot of people who have harmful patterns of drinking, they drink to cope. So it's not because of enhancing experiences. It's not because of social conformity. It's not because of social cohesion. It's to cope. And that's the majority of people that I see in my clinic. It's because
Mhm.
they are people who are drinking to cope with anxiety, depression, trauma, flashbacks, nightmares, insomnia, there is an underlying trauma very often that's driving this drinking behavior.
A lot of times, when we talked a little bit about it off record already, but when I see people, they also justify it with it's just a glass every so often. It's not, or a bottle on the weekend, or I can tolerate a lot. That's why I'm drinking a whole bottle. Um, it's a way of also, you mentioned the way we think. I think that's so important
Yes.
for everyone who's listening. David, what you're gonna share about that?
Yeah. So I'm going to talk about cognitive distortions. So one of the common cognitive distortions that people will maybe recognize is that analogy of the glass being half full or
Mhm.
half empty. So when we have a kind of condition like depression or anxiety, it actually changes the way that we think. So in depression, for example, somebody who's depressed will automatically have automatic negative thoughts. They'll see the glass and they'll see it as half empty instead of being half full. And it's a distortion because it's changed the way that they see the world around them. But with addiction, the exact same thing is true. Addiction changes the way that you think and the way that you see the world around you. And one of the common cognitive distortions that you see in addiction is permissive thoughts. So when I have people in my clinic and I ask them, what were you thinking before you had that cigarette or that line of cocaine or that glass of wine? What were the thoughts that you were experiencing? What did you notice? Those thoughts, feelings. And often they'll say to me, yeah, I was just thinking, well, I've had a really hard day at work, so I deserve this. Or it's only a glass of wine, everybody else is doing it. Or yeah, I know that cocaine is bad for my heart, but like one line of cocaine doesn't mean that I'm an addict, or doesn't mean that I'm going to have a heart attack. Um, it's
Mm.
there, and we call these permissive thoughts because it's it's a cognitive distortion that occurs in addiction, which allows you to carry on this behavior, which you know is harmful, which on a rational level, you know it's bad for you. It's not serving you, but it's a way of distorting reality that allows you to carry on with this behavior. So that's one of the things I would always do in my clinic is to try and understand what are the thoughts, what are the pattern of thoughts, and if you can catch these permissive thoughts, then you can challenge them, and then you can change them. And again, we talked about this earlier off camera, but one of the things that I think is a really useful technique that anybody could try themselves, if you notice yourself having one of these permissive thoughts that's distorting reality, that's giving you, it's justifying the behavior, why don't you try externalizing it? So don't say, I deserve this glass of wine because I've had a hard
Yeah.
day. Tell yourself, I've noticed these thoughts that are occurring.
Mhm.
And these thoughts are saying, you deserve this glass of wine and you've had a really hard day. You deserve it. Externalize it. These thoughts they don't belong to you. In the same way that the people who are very depressed or very anxious, they might catastrophize or they might have very kind of negative self thoughts. Externalize these negative self thoughts as coming from another source. And then it's easier to challenge it, name it, give it an identity. Again, with my patients who I see in clinic with addiction, I'll often describe addiction a bit like a parasite. This addiction to cocaine or cigarettes or alcohol, it doesn't care about you. It just wants to survive, just like a parasite does. It lives off of you, and without you, it can't exist. So this parasite, this external parasite,
Mhm.
it will tell you anything to survive. And it will lie to you. It will mislead you. It will distort reality. It will tell you things like, just stay at the pub. One more drink won't hurt. Don't worry about your last train home. You can walk home. It'll be safe to walk home, or you can get a taxi, or you can have a long lie in the morning. Like your husband or your partner can look after the kids. You deserve this. It will say anything to you because it wants to survive. It wants to continue this pattern, and so that's one of the approaches I work through with my patients, and it stems actually from cognitive behavioral therapy, which is evidence-based, research-backed approach with decades of literature that proves that this is an approach that works. So identifying, catching those cognitive distortions, challenging them, answering back to this parasite, and challenging it and changing those thoughts to something which is much more aligned with your actual beliefs and values and what you want your life to look like.
Wow. I think that's really helpful. The kind of detaching, the disconnect between your thoughts. I think that's so important that not everything we think is actually who we are. Huh? That's such an important message. Also, the way you described it, I thought it was really helpful for
Mm,
you to understand how a depressed brain talks to you, basically, or that how what messages it sends to you in a way of thinking, and it's almost like a filter of, let's say, negativity, and it's
mm,
not something you can just snap out of. But with training, how I hear it
yeah,
is you can do that. Is there other ways of how you help someone with an addiction? Is it's the training with the thoughts, the awareness, CBT, but are there other ways?
definitely. I mean, it's funny because we call it cognitive behavioral therapy, CBT,
Hmm.
but sometimes I call it cognitive behavioral training, like you said, because
Hmm.
I tell my patients that your mind is like a muscle. And sometimes this is difficult to do at first. Externalizing these thoughts, catching those thoughts, challenging them, changing it is difficult. But your mind is like a muscle, or your brain is like your biceps. You can train it. And the more that you practice this, the easier it becomes. The other thing that you said that I really liked, actually, I'm really enjoying our interview because I feel
Me
like we're
too.
we're very
I
aligned
like
in a
it.
lot of
That's
the things
great.
that the way we practice. Um, is that the way that we see the world and the way we think about the world doesn't necessarily mean that that's true. So the other thing that I say to people is your feelings are not facts, and your feelings are very real, and they're very real, but they're not. It doesn't mean that they're representative of the world. So what I would say to people sometimes when they say to me, "I'm worthless," or "I'm useless," "My life will never get better," "I can't cope without drinking," and I'll say to people, "Is this a feeling, or is it a fact that you are worthless, or that there's no hope for you? Is this a very strong feeling that you have, which is really powerful, very strong, or is it a fact?" And that's where sometimes you can help people to really explore the world around them, explore the reality, and challenge these very strong feelings, which can lead to very strong thoughts, and then really strongly reinforced behaviors, and just sometimes unpicking the facts from the feelings.
Really cool, like a fact check.
Yes,
Let's do a fact check and also challenge the thoughts that we have. Would you then say journaling is a helpful tool?
I love journaling.
Me too.
I
I'm a
think
huge fan.
I think we should all journal. Um, and journaling, good quality journaling is when in my opinion, I don't know what your thoughts actually are, but it's when people are really reflective, and so they will identify in a very factual way what's happened during that day and break it down um, in a non-judgmental way. So not being self-critical. This isn't about passing judgment on what you did or what other people did. Just in a very factual way, documenting what happened. And then in a objective way, imagining you're a third party with a helicopter view, trying to look at that situation again with a fresh set of eyes. Now that you've got hindsight, looking back at that situation, is there anything, what, well, how would you perceive it now? Is there a different way of looking at it with this new fresh set of eyes that you might think or feel differently now? And how would this change your behavior in the future? Or how would this change your thoughts or your feelings in the future the next time you encounter a situation like this? What can we learn from this situation? That for me, that's what good quality journaling looks like. Not ruminating or dwelling or
Yeah.
repeating the same thoughts over and over again. It's actually about taking a helicopter view with a fresh set of eyes and being curious, exploring new ways of thinking and feeling about that situation.
That's such a great self-awareness practice. I love that journaling. Even if you have it, leave it a few hours or a day and look back and go into checking like what you've written down, the facts, and observe yourself also. How do you feel about it now?
Yeah,
Looking back, that's what I find it so powerful.
Definitely. And I mean, not all of us will have time to sit with a paper booklet and
Hmm.
write those thoughts down. But we, I could be on the bus sometimes or the train home, and I'll just take a moment myself to do like a mind journal and to try and reflect on different things that have happened during my day and take the exact same approach, even if I'm not writing it down. But it's a great practice, and it's something that I think everybody could benefit from.
I totally agree. But what do you think from experience and how you see people, let's say, getting better? How long should we journal? Like every day and for a month? Or because the science always seems to be changing. When I started to look into
Mhm.
journaling, that was maybe like 10 years ago, it said do at least 30 days and then you will notice, let's say, also in terms of habits and so on, a small change. But now
Mhm.
it increased to 60 days. So I see
Yeah.
sometimes a little bit of the shift. And obviously, that's also research and so on, that
Yeah.
things change. And we need to obviously have the critical eye about
Yeah.
research always. But what's now the answer for people who want to start this? And how do they go about and do this? And for how long?
Yeah. So when should you start journaling and how long should you journal for? I don't think there's a right or wrong answer. I think it's a very personal thing. But if we think about the comparison with our body, our physical body,
Mhm.
if we had a knee injury and we had to then start physiotherapy and then go to the gym to strengthen the muscles around our knee, when do you start and stop that? Well, I suppose you start it when you identify that there's a problem, maybe. There's been some trigger that's made you
Mhm.
go for the physiotherapy and then start to go to the gym to train the muscles around the knee that's injured. But when do you stop? And arguably, do you stop when the pain is gone? Or actually, maybe this is a long term habit that's going to be good for your
Yeah,
physical health. It's going to make you feel good about yourself. You're going to get all the endorphins from going to the gym, and it's going to prevent injury of that knee again in the future. But I think the same is exactly, I think our mental health and our physical health aren't really that different. And
I agree.
if
Yeah.
something's good for your mental health, then keep doing it.
Yeah,
You know, if this has helped you to recover from addiction or from trauma, keep doing it. You
I
know,
agree. It's a lifestyle you need to be integrated into your daily life somehow through small things.
exactly. Integrate it with your daily
Yeah.
lifestyle. So often, again, with my patients, or I mean, we talked about, I'm not kind of keep plugging the app, but one of the things that we do is we try and encourage people with these daily habits, like journaling, to habit stack. So what I mean by that is link it with another pre-existing habit. So for
Hmm.
example, every morning I always brush my teeth. I never forget. So if I wanted to start doing something new, like journaling, I would link it with that pre-existing habit, brushing my teeth. So after I brush my teeth, I would journal. And it doesn't have to be big, long journal entries. It could be a minute or two. In fact, actually, it's easier to start new habits when you start small. You know, another thing I never forget to do every day is drink coffee every day, every morning.
Same.
My body will not let me leave the house
No.
until I've had a coffee.
I have cravings for it,
Yeah,
and the headache if I don't have it. It's very strange.
it's part of my routine,
Hmm.
right?
Yeah.
So if I started a new medication, I would just put that medication, and I do this with my patients actually. You know, patients who've got ADHD, for example, they always forget to take their medication. But I'll say to them, if you drink coffee every day, put the medication for your ADHD next to the kettle, and then you'll never forget it because you never forget to have coffee. It's an existing habit. So you're habit stacking, you're layering one
Oh,
habit on
grand.
top of the next. And it's so much easier that way. But whether that's medication or whether that's a digital tool or whether that's a practice like mindfulness, meditation, journaling, that's the best way I think to adopt these new habits.
Oh, I like that one. That's really good. What do you call it? Like stacking? Habit stacking?
Habit stacking.
Oh, great. That's really good. Connecting with already an existing habit. That's great. But speaking about addiction, I mean, is it
Mhm.
really enough to challenge my mind and to challenge the thoughts, the way I think, that I can help myself out of the addiction, or do I need more?
So I think we need to take a 360 approach. And in medical school, we were always taught to use the biopsychosocial model. So that's biological, psychological, and sociological model. So sometimes our bodies need kind of some biological help. So there's medications that can help with different types of addiction. So with alcohol, there's licensed treatments available in the UK, the USA, Europe, like medications called acamprosate, disulfiram, naltrexone. So sometimes our bodies need some medical assistance. And if you're going through alcohol detox, you might need medication like fluoridazole epoxide. So there's sometimes medications that can help us with that process of detox and also with preventing cravings after detox. But as well as the biological, there's a psychological approach, which we talked about using CBT, reframing our thoughts, like with journaling exercises. But then there's the final kind of triad in that biopsychosocial model is the sociological factors. And one of the things that I would say to patients in clinic is looking at your social life, the world around you, your work-life balance, the relationships that you have with your partner, your friends, what are your hobbies, what are your activities. And it's not enough just to take medication or to change your thoughts. Sometimes we need to change our environment. If all of your friends just drink really, really heavily, and all of the activities that you do for fun socially revolve around alcohol or drinking, then it's going to be really difficult to curb your drinking or to quit drinking. So it may be that you need to, or explore other ways of having fun or different social circles where alcohol isn't the one thing that you have in common. You may be, and it could be anything. I always encourage people to be like adventurous. And I say move your. I don't tell people to exercise. I'll say move your body. So that could be rock climbing. It could be ice skating. It could be yoga. It could be running through the park. It could be walking. It could be Pilates. It could be anything that moves your body or that gets you doing something different that doesn't revolve around alcohol. But I think we have to take that 360 approach using the biopsychosocial model, and it has to be all of it.
And do you see also when do you scan people's brain sort of before and after, or do you notice, or do you have you seen it in your practice somewhere that you say like, hey, after a year you see an entirely like change in the brain? Is that happening with neuroplasticity, that if you apply all of those tools, that this internal, let's say, healing process can take place?
I love that you mentioned neuroplasticity because, again, I mentioned I did background in neuroscience, and your brain is so interesting because it's not a fixed structure. It can change. New synapses can grow, and they grow when we reinforce certain patterns of thinking. That's when our brain adapts, and like I said, you get this neuroplasticity where we can essentially change the way that we think and we feel by practicing, rehearsing different ways of thinking. And so do I scan patients? No, generally not. Mainly because actually there's always side effects of scanning with radiation. And so generally it's not, the pros don't generally outweigh the cons, and it wouldn't change the treatment plan. But in research, we do. Researchers and academics would do brain scans. And yes, when you adopt healthier habits, when you stop drinking, your brain structurally, functionally changes. So it's real science. It's real medicine science.
I love that. It's amazing. Is it also possible at any age?
Yeah. It's never too late to change habits. And the other, if I met a patient and they said, "I've been smoking all my life, I can't quit now," or I don't know, "I'm 70 years old. What's the point on me quitting drinking because I'm 70? I would say that sounds like a permissive thought.
I love that. That's super important, David. That's so important. Really, I mean this because so many people come with this belief: I'm too old, I'm too long in this habit. No matter what habit it is, it applies to all of them, right? If I have, for example, let's say a porn addiction or gambling addiction, I can do the same thing that you just suggested, all of those tools, and change my brain and basically overcome this, right?
Always. You're never, definitely, you're never too old to change habits and ways of thinking and feeling. I would always want to inspire people to be hopeful, to be curious. And as an example, I swim, and I swim in a master's swim team for people who are basically adults. And I've gone to swimming competitions where there's 80-year-olds who have never been able to swim before, but then after retirement, they've decided, I'm going to learn to swim. and they discover this incredible activity which moves their body in a kind of gentle way, but it also encourages them to think about their breathing, when they're swimming. And it gives them that kind of opportunity in the water to be mindful, to reflect, to mentally journal what's happened during the day. And I've seen that with 80-year-olds at swimming competition, masters swimming.
Wow. I like that. That's very good. I love swimming. I'm gonna try that too.
Yeah.
Maybe not on your level.
No,
but
not so much anymore. It's been a while, but yeah, I love swimming as well. I think it's such a good way to look after your mental health for so many different reasons.
One thing that I sometimes see is, and I don't know if obviously you're the expert here, notice that sometimes people feel like they have, let's say, overcome their habit, their addiction, but maybe a few months later, years later, they notice, it's shifted onto something else instead of that I actually, let's say, came it, or healed my addiction. I just shifted now from, let's say, drug addiction. I became addicted to shopping, or a pattern of I go into relationships or other ways. What advice would you give people like them if they notice the shift? And how do I notice, hey, I've done the work, it's working for me?
So that's so interesting, because you've essentially described a phenomenon that we call transfer addiction. And that's where the addiction moves from one substance to another substance. Very common, particularly with alcohol. People who quit drinking, they get cravings for sugar, which isn't the worst thing in the world, but it's just something to be mindful of. So what advice would I give to somebody who's noticing transfer addiction? So I would probably say, well, have you addressed the underlying cause? Because are you still self-medicating? Again, if it's self-medicating for trauma, for anxiety, depression, maybe you stopped self-medicating with alcohol, but you're now self-medicating with gambling or porn or shopping. Is the underlying need, has that been addressed? And maybe that underlying need has not been addressed. There's the other thing, actually, just to acknowledge, because people might have heard of this as well, is the 12-step model. And so very often with the 12-step model, people will identify with being an addict, and they will say, I am an addict. And they take this part of this, they take upon this identity that they live with for the rest of their life. And they will say things like, I will always be an addict. And for some people using this 12-step model, that's really helpful for them, because it helps to always remind them that they are vulnerable to addictive substances or addictive behaviors. Not everybody likes that model, and this is why we need to be adaptive with our patients and people that we look after, because it isn't a one-size-fits-all approach. So not everybody will appreciate being told that they are an addict, and that's actually not helpful for a lot of people. But what I do often say to my patients as well is, please don't be complacent. When I've looked after people in the past and we've successfully got them into recovery or managed to get their habit under control, where they slip up is when they become complacent. And, I might have had somebody come into this hospital here, they've had a detox and they've done really, really well. And then 6 months later, maybe a year later, they say, well, I'm not an addict anymore. I'm not addicted to alcohol. I don't have an alcohol problem. And they're at a birthday or a wedding and somebody hands them a glass of champagne and they say to themselves, well, I'm not an addict anymore. I don't have a problem. Look at me. Like, I'm doing really well. I look great, feel great. I'm working, got a really great job. So I can have one glass of champagne. And it's that complacency, again, a permissive thought, that complacency is the thing that gets them. So I always say to people, actually, it's like, you've come to the hospital, you've had this great detox, and however much you've spent on that private healthcare, that's how much that glass of wine is going to cost you. So that's not a £5 glass of wine. That is a glass of wine which could cost you however much you've spent all of your therapy and detox. That is what you were spending on that glass of wine. So don't do it.
Whoa. And does the 12-step program apply only for, let's say, alcohol, drug addiction? Or could I, let's say, if I have another form of addiction, can also be, let's say, binge eating or something else. Do I use the same sort of steps, or is there for every single, let's say, addiction or form of pattern a different approach?
This is such an interesting question and controversial question because there's often quite heated debate about this. So there is a 12-step program for cocaine, and I think also for sex addiction as well. But there's controversy over whether or not it is transferable to those other habits and substances, and whether or not there's evidence and proof that it works. But it's funny because there are people who have done this 12-step program that feel so strongly, they're passionate, almost evangelical about this, and it becomes such a strong part of their identity, and it works for them. So, I mean, I was a research fellow at the Institute of Psychiatry, and I have a degree in neuroscience, and I consider myself a scientist, and I love evidence and having proof that something works.
Yeah.
And for me, that's what I always look for. But on the other hand, if somebody tells me that this approach has worked for them, who am I to question it? Because I might be an expert by education, but they are an expert by experience. And so I think people should, the most important thing, if you've recognized that you have an addiction or a harmful habit that's causing you, problems in your life, the most important thing is that you acknowledge it and that you seek help. And it may be that you have to try different approaches, but find what works for you. Listen to great podcasts. You called me an expert. You're an expert as well.
Are.
Listen to people like yourselves and sharing this information, and be curious. Try different things. See what works for you. It might not work first time. You might have to try this 2 or 3 times even. But every time you have a relapse, and every time you kind of try again, you're learning, you're developing new skills, and you're getting better. I think that's the most important thing.
Thank you, David. For everyone who is watching and listening right now, and they maybe identify themselves as like an addict, or they're like, oh, this resonates with me. What would you tell them? How would you encourage them to seek help or make the first step? Or what could be the first step? Maybe not directly going into a clinic, but what could be a self-help step they could be doing?
Yeah. So it depends on what the harmful habit and addictive substance is. The one that I know most about is alcohol. So there are a number of really great charities where there's free help and support available to people. So in the UK, there's a charity called Alcohol Change UK, but you can access their website wherever you are in the world. But their name is Alcohol Change UK, and they've got loads of brilliant resources that would really valuable that could help people. There's also the National Health Service in the UK, again, has really great resources as well. And again, you can access these websites wherever you are in the world. And then, of course, there's face-to-face clinical services like we have here at the Priory Hospital, the Priory Group. We have hospitals across the whole of the UK. But I think also even in Europe and Middle East, actually, I think they're expanding into those areas as well. So looking for clinical services in your area. And of course, I'm the founder of a digital program called Curb.
That's really wonderful. David, you did something that is available globally and for everyone, and with a true passion and mission behind. Can you share a bit more about your app Curb?
Yeah, so thank you so much. So Curb is a evidence research-backed tool to help people to change their relationship with alcohol. And who is it for? Curb is for anybody that's recognized that maybe they have a harmful relationship with alcohol. Maybe they're just drinking too much. Maybe they want to curb their drinking behavior. Maybe they want to drink a little bit less. Maybe they want to take a break for a month or two, or maybe they want to quit altogether. And we have people on the platform who have been sober for many years, but they've joined the platform because they wanted to be part of a community of other like-minded people who have a shared experience. And so essentially it's a digital platform. It's available on an app. You can download it for free at www.curb.health. That's probably the easiest way of finding us.
Perfect. It's going to be also in the show notes or in the captions below.
Oh, thank you. Thank you. I really appreciate it because, like I said, it's a passion project for me. I don't make any money from this platform. we're funded by the UK government's Innovate UK funding body. That's the government's research and innovation body, and then a couple of angel investors as well. But I really just wanted to make good quality research backed tools available to anybody who needs them. And so we have a 30-day program, and it's essentially me delivering these one-to-one sessions to camera. I speak to camera as if you were in my clinic with me, but instead of having to, have waiting list times for public services or spend lots of money in very expensive private services, we built this program which is hyper accessible. You can use it in the comfort of your own home, in the privacy of your own home. Nobody has to know. You can be kind of public, and you can share pictures of yourself if you want. You can celebrate this journey that you're going on, or you can do it completely privately and anonymously. But it's a one-to-one program that I deliver to camera to people over these 30 daily lessons. But then we also use very clever technology to have these interactive exercises so that we can put into practice all of these cognitive behavioral training tools, all of the dialectical behavioral training tools, put them into practice so that you can access this program. Most of the program is completely free as well. All the best bits in some ways are completely free. And if people want to upgrade to get the enhanced version, then it's £70 in the UK. In the US and Australia, different countries, but in Europe, that'll obviously be converted. But it's a bargain. I genuinely think it's
really
very good value.
Oh my God. Thank you, David, for doing what you're doing. So if you could relate with the things we talked about in this episode, and you are struggling and you're in need of help, please make use of David's app, www, like Curb.
Curb, CURB, yeah.
Sorry. You will find it in the notes, definitely. Find the link, make use of it. David, that's a wonderful project. I have one last question, because maybe people are wondering the same. Are you drinking yourself?
Yes. So it's funny. A lot of my friends, when I started this company, Curb.health, or even doing what I do for a living as a addiction psychiatrist, a lot of people assume that I don't drink. But I do. I do enjoy drinking alcohol, and I have to be honest about that. I think that's important to be transparent. But though I am very mindful, I'm very conscious about how I drink. And I always ask myself, if I'm about to have a drink, I always ask myself, how am I feeling right now? Why am I drinking? Am I drinking because I'm bored or lonely or hungry, angry, tired? And actually, those aren't always the best reasons to drink. And is there a better way of serving that underlying need? So I do drink, but I will always ask myself before I drink, why am I drinking? I guess like anything that's not good for us, I just try and make a mental note of how often I'm drinking. And, am I drinking more than 2 days in a row? Or in a week, am I drinking more than 2 or 3 days in a week? And am I in control of how much I'm drinking? And it's just something that I'm mindful of. But I do drink, and I think that's important to be transparent about. So I'm never judgmental as well. That's the other thing. I think that everybody has a right to make their own choices and what is right for them as an individual. My job as a psychiatrist is to help people with their goals, whatever that goal is. I'm here to help you to navigate that journey.
So you're describing a very mindful way of drinking and making an emotional check-in, the reason why I'm drinking. That is very cool. Yeah. I like that. David, it's been a true pleasure. You have given me so much value and input. I could have continued for hours talking to you. I think we would be completely nerding here.
I've honestly, I've really enjoyed it as well. It's been a total pleasure. I really
hope we can meet again in the near future and talk more about this topic that needs not just more awareness, but also understanding, and the help is really, really needed. David, thank you for your time and that we could come here into your office in London. Thank you so much. Much appreciated.
Thank you.
And if you liked this episode and you would like to see more episodes just like the one today, then please hit the subscribe button and support my podcast so that I can help you and continue helping you on your healing journey. And please remember to take good care of yourself. I'll see you in the next episode.